بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أعزائي الطلبة، اليوم محاضرتنا استكمالا للنيرسينج مانجمنت for patient with cardiovascular disorder. سيتم شرح nursing care for patient with hypertension. High blood pressure or hypertension is a common condition in which the force of blood on the walls of the arteries is often too high. Arteries are the blood vessels that carry blood away from the heart to supply the tissue with oxygen and nutrition. In the heart, two chambers called ventricles contract with each heartbeat to push blood to the lungs and through the arteries to the body. As blood flows through them, three main factors affect the pressure on the artery walls. The first is cardiac output, or the amount of blood the ventricles push out of your heart each minute. The blood pressure goes up as cardiac output increases. The second factor affecting the blood pressure is blood volume, or the total amount of blood in your body. Blood pressure also goes up as blood volume increases. The third factor that affects the blood pressure is resistance, which is anything work against the blood flow through your arteries. Several factors contribute to resistance. One resistance factor is the flexibility of the artery wall. Healthy arteries expand with each heartbeat to help reduce blood pressure on the wall. Another resistance factor is the diameter of the arteries. The body is able to increase the diameter of the arteries to lower the blood pressure. Or reduce the diameter to raise the blood pressure. A third resistance factor is blood viscosity or thicknesses. In the body, more particles such as proteins and fat increase viscosity. If the blood is thicker, the blood pressure goes up as the heart works harder to push it through the arteries. The blood pressure can be measured with a device called a sphygmomanometer or blood pressure cuff. When your heart beats, the pressure of blood on the walls of your arteries is called systolic pressure. When your heart relaxes between beats, pressure on the artery wall is called diastolic pressure. While the blood pressure may change throughout the day, it should normally be less than 120 millimeters of mercury for systolic pressure and less than 80 millimeters of mercury for diastolic pressure. If the systolic pressure frequently stays above 140 or the diastolic pressure frequently stays above 90, you have high blood pressure. Over time, high blood pressure will damage the wall of the arteries. The artery wall become weak, and from an enlargement called an aneurysm, or the wall may be burst and bleed into the surrounding tissue. Small tears in the artery wall may attract certain substances in the blood, such as cholesterol, fat, and calcium, to form a build-up called a plaque. Blood flow through the artery decreases as plaque enlarges. Blood cells can stick the plaque and form solid clumps called clots, further reducing or completely blocking the blood flow. Damaged arteries raise the blood pressure even more by making the heart beat more forcefully. Artery damage and reduced blood flow lead to conditions such as a stroke, heart attack, or kidney disease. In most cases, the cause of high blood pressure or hypertension is unknown. This type of high blood pressure is called primary or essential hypertension. Treatment for essential hypertension includes lifestyle changes such as a healthy diet. If the patient is sensitive to the sodium in salt, the doctor may recommend limiting intake of salt and high processed foods. Sodium may cause the body to retain water, which increases both the blood volume and the blood pressure. Other lifestyle changes that can reduce blood pressure include avoiding excessive alcohol intake, getting regular exercise, losing weight if you are overweight, and quitting smoking. The doctor may also recommend medication that act on the kidneys, blood vessels, or heart to help reduce the blood pressure. Diuretics, commonly called water pills, cause the kidneys to move more salt and water from the blood into the urine, which reduce the blood volume and pressure. Beta blockers reduce the workload on the heart by decreasing both the rate of the heartbeat and the strength of the heart conditions. Several types of drugs act directly or indirectly to reduce the blood pressure. By relaxing the blood vessels, which increases their diameter. These drugs include angiotensin converting enzyme inhibitor, angiotensin 2 receptor blockers, calcium channels blockers, and direct acting vasodilator. The most common nursing diagnosis: deficit knowledge related to lack exposure to hypertension information, ineffective therapeutic regimen management related to complexity of therapy, cost of medication, lack of symptoms, side effect of medication. Thanks for listening.